Taking a history, or to be more specific, taking a sexual history from a patient could be a challenge, and it's the most awkward thing in history taking. It needs a skillful and respectful doctor that knows how to communicate respectfully to his or her patients. Today with you, we will learn how to take a focused history from an HIV patient. But let me tell you that history taking needs multiple practices. First, we should take personal history. The environment of taking history is important, and it should make the patient feel comfortable to talk freely. The doctor and the patient should face each other in a private, soundproof room.
Hello, my name is Dr. Ahmed, and today I'm gonna be your doctor. Can you tell me your name, please?
Hey Dr. Ahmed, I'm John.
Hey, John. I'm here to help you. In order to do that, I need to ask a few questions. Is that possible?
Yes, of course.
How old are you, John?
You shouldn't rush into the history. The doctor should emphasize that the information is confidential.
Okay, John. Before we start, I just want to assure you that anything you say will be confidential. So feel free to talk. Okay?
Sure, it's okay.
How old are you, John?
I'm 26 years old.
So what do you do for a living, John?
I'm an accountant in a local bank.
Where do you live, John?
I'm living here in Riyadh.
After the personal history, the history of presenting illness always comes after it.
So you are here because you have HIV infection from having prohibited relationships with men. Is that correct?
Do not assume. Presumptions are often wrong. So ask. Assumptions are the mother of all misunderstandings.
What brought you here, John? Tell me the story.
Oof. Okay. 4 weeks ago, I got the promotion that I've been waiting for. Me and my friends said we should celebrate it. We thought traveling would be nice, so we traveled to Bahrain. And then we came across a club. We started to be curious as we have never seen a club before, only in movies. When we got in, we didn't know anything about what it's like to be in a club. The bartender asked us, "Why are we here?" We told him that we are here to celebrate my promotion. He came closer to me and said, "Do you want to be happy?" I said, "Of course. I came here to enjoy myself." They blindfolded me and sent me to a room. The minute I removed it, I saw a naked prostitute, and I couldn't hold back not to have sex with her. After that, we returned to Riyadh. 3 days ago, we went to donate blood, and yesterday the hospital called me. They said I am HIV positive, and that's why I'm here.
How dare you? Aren't you a Muslim?
Do not judge the patients. Respect them and use appropriate language. The doctor should ask questions in a sensitive and non-judgmental way. Using inappropriate language or judgments won't help you to take an honest and clear history, since patients won't feel safe using this language.
Interesting story. How did you perceive the problem, John?
I came to the hospital 3 days ago to donate blood. Yesterday, they told me that I am HIV positive.
After hearing your story, John, now I need to ask a few questions so we can fight this virus together. Okay? Do you have a fever, John?
Yes, started 5 days ago.
Do you sweat while you are asleep?
Usually not. Now, I sweat some nights.
Have you lost any weight, John?
No,
Do you have any ulcers?
only one in my mouth.
Do you have any skin rashes?
No,
Do you have any enlarged lymph nodes?
yes, back to my jaw.
Is there any pineal discharge?
No, but I have been urinating a lot.
Do you have any bowel or bladder symptoms?
Yes, I have suffered from diarrhea
How long have you been suffering from these issues?
for 2 weeks.
Detailed sexual history. It is the most important part of taking a sexual history from an HIV patient. Gaining an accurate sexual history is vital for the effective treatment of patients and their sexual partners. Remember that one of the most important things while taking sexual history is to be not coercive. Sensitive information is usually taken with time and trust.
Okay, John. Now I'm gonna ask you a few questions that may be awkward, but remember, anything you say will be confidential, so feel free to talk. When did you last have a sexual intercourse?
4 weeks ago,
Was it with a man, or a woman, or both?
with a woman.
Was it with a regular partner?
No, she was a prostitute.
What kind of intercourse was it?
Through the vagina.
Were barrier contraceptive used during the intercourse, like condoms or femidoms?
Why do you need this information?
Patients may ask why certain information is required, and the doctor should be able to give a full explanation.
Good question. Because condoms or barrier contraceptives in general can prevent the transmission of sexually transmitted diseases.
Okay. No, I was not planning to have sex.
Wonderful, John. We are in the right path. Do you have any information about your partner, if he has any similar symptoms or any symptoms at all?
I don't know.
Nice, John. Have you had any other partner in the past 3 months before this happened?
No, only her.
Okay. Did you have any pain during or after the intercourse?
No,
Have you ever had a sexually transmitted infection before?
no.
Have you ever had a sexual health screening before?
Yes, last year when I donated my blood, they gave me free sexually transmitted diseases screening.
Have you ever been screened for hepatitis, syphilis, HIV?
No,
If not, explain a blood test is involved.
Okay, John, we might need to take a blood sample from you to do the screening. Is that okay?
yes,
Okay. Have you been vaccinated against hepatitis B?
yes, when I was a child.
If you haven't, then assess risk and offer vaccinations if required.
Wonderful, John. Do you have any allergies to medications, food, or animals?
Allergic to penicillin.
Do you use any drugs, John?
I don't use drugs.
We almost there, John. Do you have any serious medical conditions?
No,
Did you have any surgeries before?
no.
When you are done taking history, greet the patient and ask if they have any questions.
Thank you, John, for coming and cooperating. If you have any question, please ask me. And this is my office number, just in case you need anything.
No, I don't have any questions. And thank you, Dr. Ahmed. You have been a respectful doctor.
This work was done by Naif Slays, Raid Rajeri and Mohamed Ligirni. Thank you for watching.